So hi everyone, I'm Sir Baninio Angelo, and for today, I'll be discussing how to check blood pressure. So gather your supplies. We need a stethoscope and a blood pressure cuff. Fortunately, I don't have these things with me. There's no one I can borrow them from, and I can buy it, especially in today's situation. I can't afford it yet, but I'll do my best to explain and demonstrate how to check blood pressure. But before you start, first, you have to perform the hand hygiene. So after performing the hand hygiene, don't forget your gloves. And to start off, make sure your patient is sitting down with their arm at heart level, because different arm positions below heart level have significant effects on blood pressure readings. And their legs are uncrossed. And of course, the materials that we're going to use, the stethoscope and the blood pressure cuff. And you have to make sure to use the right size cuff to your patient, because if it's too big or too small, it can throw off the readings. The patient's arm out, palm up, support the arm so that the muscles are relaxed. So place the cuff on the bare upper arm 1 inch above the bend of your elbow. Wrap the cuff around the forearm, ensuring a snug fit. Ensure the index line lies within the range marks on the cuff. Secure the cuff on the bicep and squeeze the balloon to increase pressure. So how are we going to do that? We have to palpate the brachial artery, because that is the artery that we are going to listen to get the systolic number, the top number, which is the first sound, and the diastolic number, which is the bottom number, the last sound. And that is the part where we are no longer hearing the sound. So hi ma'am, what's your name?
I'm Mrs. Nelia E. Serban.
And how are you?
I'm fine.
Okay, so I'm Mr. Serban and I'll be taking your blood pressure today. Okay, so just relax.
Yes.
So in measuring the blood pressure, you also have to focus on the device, that circular device, the monitor. So hold the bulb in your right hand, press the power button, all display symbols should appear briefly, followed by a 0. And inflate the cuff by squeezing the bulb with your right hand. Watch the gauge. Sit quietly and watch the monitor. The first knocking sound that you are going to hear is the systolic pressure. When the knocking sound disappears, that is the diastolic pressure. So record your reading, then carefully remove the cuff from your patient. Now, the normal pressure readings according to the American College of Cardiology 2017, in systolic, we have less than 120, and in diastolic, less than 80. In elevated blood pressure, considers 120 to 129 in systolic, and we have less than 80 in diastolic. We also have the hypertension stage 1, systolic 130 to 139, and in diastolic 80 to 89. So that's how you're going to record and perform in getting your blood pressure using a blood pressure cuff. So I hope you learned something from this video, and thank you.